Hey everyone, welcome to the show today, my so-called fabulous. I'm Tiffany and welcome to this show. You know, I have tried and tried for 6.5 years with this show to help solve problems, help bring meanings to life, and I can't do it alone at all. So I am dependent on my fabulous guests, and I have another one in the studio today. So let me read a little bit to you. On today's episode is one that speaks to so many people because when you're talking about this, especially researching this topic of dementia and Alzheimer's, you begin to learn and meet people that it's touched their lives, so many lives. I'm joined by Cheryl Harding, President and CEO of the James L. West Center for Dementia Care in Fort Worth, Texas. Not just Fort Worth centric because they reach so many people globally. And we talk about that in this two-part series and the next series specifically. This organization is doing incredible work in the space of dementia care, education and support like you have never seen. Not just for individuals, but for families, entire communities, caregivers, and healthcare professionals. Today, we're going to talk about Cheryl's journey, the mission behind James L. West, the history, and what matters more than ever. Cheryl, I am so glad you're here. Thank you for being here. Oh, my goodness.
Thank you for inviting me.
Absolutely. I met you a few weeks ago. Our precious JT Augenbaugh and the team at JP Morgan introduced us. I was so blessed. And then I went and attended your fundraiser last week, I believe, a luncheon, and it was unbelievable. The education sitting in that room and listening, hundreds of people, which should tell you a little bit about this mission, correct?
Right.
So let's just get started. What led you to this work in your life and your career?
Well, years ago, I started working in senior living. So really more campus setting type organizations providing, independent living, assisted living for older adults. So always been in the not-for-profit world and providing services for older adults. Fell in love with it. Had a great time meeting some inspiring, amazing older people who were just living well, and felt like I was making a difference every day. So I've stuck with it. I joined James L. West 8 years ago, which was really my first time in a dementia care focused organization, but love that we're a not-for-profit and we do amazing work in so many ways. So I've learned a lot about dementia as well. So,
And then this journey, is there a moment that you said, okay, yes, obviously you interviewed for a different type of elderly care or in facility versus what you're doing now, which is so much more than dementia care and being in a memory center, of course, and we'll get to that. But is there a moment that you said, this is it, this is my life?
yes, I mean, I would say that was years ago that I really fell in love with working for a not-for-profit because I felt like we were making such a huge difference. I've always worked for organizations that did more than just provide a service.
Right.
So I don't know, going home every day and knowing I impacted someone's life. To be able to come to James L. West, to an organization that was so well established already in the community, but that has so much potential for growth, that was exciting to me. And I believe we've been able to do some really cool things in the last 8 years and have a lot of things on the horizon.
So those of the people that are listening and watching, what is James L. West?
James L. West is one of the most unique organizations I have ever come across in all my years of serving older adults, in that really we have a niche purpose. We have a very, very special mission of serving, supporting, educating, caring for people who are on the dementia journey. And it's very unique. I've been in this business a long time and seen a lot of places around the United States, and there are very few that really focus on caring for that person wherever they are in the journey of dementia.
You know, when I heard about James L. West, and I've heard for years living in Fort Worth, Texas, but what are the gaps that you're feeling that no one else understands or the majority of people don't understand? Because I thought, and I've told you this, I thought it was just a memory care facility, and that's all, that's it. And when I met you and Jamie, that's on our show next week, I was like, oh my gosh, this is I couldn't believe it. So share with us all the paths.
There's so many
So many.
differences about James L. West. First of all, it was born out of a need in the 80s with First Presbyterian Church, Mrs. Eunice West. They came together to fill a need. She saw a real need for care options for people like her husband who had Alzheimer's. The group at First Presbyterian, they have always had a passion for older adults and had services for older adults, and they just saw that they had an opportunity to do something unique. James L. West is a care facility, but so much more. The vision back then to be more than just a place to provide care was evident. Um, we began with the mission to educate others, to be a clinical site for training. So we've always had students. Most care facilities don't do that. We put a lot of resources and time into training the future workforce and showing people the best practices for caring for people with dementia. That's one unique thing. The education program alone, I don't really know of any other organizations that do the level of education that we do. That is a donor funded program. It is a big part of our mission is making sure people have the education and knowledge about dementia because it is so misunderstood. So I think, James L. West is complex. It's hard to explain. Sometimes people think you're just a memory care, but we're not. We're really providing a unique service to the community, but throughout the world, really, with our education and family support. So
You were telling me about your in-house, help me with the words here, in-house, because there is that, but then also the rehab. So that's
yeah.
two different things.
So let me explain a little bit about the services of James L. West. For one, we are considered a licensed nursing care center, which is different than most of the memory cares you see around town. Most of them are licensed assisted living. So there's two different levels of licensure, therefore different levels of regulation. So we're licensed nursing and have always been licensed nursing, which means we have the most stringent staffing requirements and licensure regulations to meet more than most of the memory cares around the city or country. So we're able to care for a person's full physical needs as well as their cognitive needs. So James L. West has 24/7 nurses around the clock. We, at any given time, 6 nurses in the building, which is unusual. So in our building on Summit Avenue, we provide long-term care. So we have care for people who need to live there with us and be cared for 24/7. But we also have a rehab program that you alluded to a second ago. We added that service just a few years ago as an attempt to serve more people because that's really been our goal here in the last several years is how do we reach more people. So we added the rehab program, which allows us to take a person from the hospital, give them focused, specialized rehab services, and allow them to go back home, whether their home is at home in the community or an assisted living community or something like that. So our rehab team is physical therapy, occupational therapy, speech therapy, music therapy, all specially trained in working with people with dementia. So people come to us and they may stay 20, 30 days with us doing intensive rehab. But the real key is that it's focused for people with dementia.
That was my question
Yeah.
because I would assume if someone has dementia that's in rehab, that is it takes a special caregiver nurse to work with that person. Is that, am
Yes,
I off
and our
base?
therapy team. I mean, they have to understand their ability to learn and to really improve. So there's a belief, unfortunately, that when you have dementia, it's a dead end and that there's no way to improve, but that's not true. And so we believe and have shown many times that a person can get better and go home, go back to their setting. People live with dementia every day in a quality way. And so that's what we want to do is make sure that people have that quality of life, have the best chance to live successfully, independently as long as possible. So,
That is amazing because we both have a friend that her father went to James L. West
mhm.
and then is now living in a home by himself across the street with his children. But that's amazing.
Yeah.
And she has said that James L. West turned her father around.
Some people are able to improve just because of diet, getting their medications correct, having the right interventions for them. You can see an improvement in folks. And certainly when someone comes to us with a stroke or hip break or something like that, we can certainly get them better and send them back home so that they can live independently again. So our rehab program is unique in that we only serve people who have dementia. Most rehab programs are open to anyone, but that is our niche and that's what we like to do. And so we feel like we're the best place when someone needs rehab to come to us. So
That's incredible. So, Cheryl, talk to us that the people that don't understand, and a lot of people will appreciate this because we just don't know until we know. In fact, from your luncheon, and this is downloadable, and we're going to have it in the show notes. I received this last week. Know It Before You Need It, presented obviously by James L. West. Incredible, and actually, your fabulous team were like, "You read it?" I'm like, "Are you kidding me? I've read it cover to cover multiple times because
mhm.
learning about this show." But tell us the difference between dementia and Alzheimer's.
Okay, so dementia is an umbrella term, and Alzheimer's disease is a type of dementia. So if I said I have cancer, you would say, what kind? And I would tell you what kind I had. It's the same thing with dementia. If I say I have dementia, then you should ask what kind. So I could have Alzheimer's or Lewy bodies or vascular, and there's over 100 types of dementia. So Alzheimer's is the most common, and that's what people know the most. And for years, it was really used as a common term of Alzheimer's disease is what everybody had, but it's really dementia. So most people recognize Alzheimer's. They don't necessarily recognize dementia. So we want people to understand there are different types.
So, Cheryl, should a person that has been diagnosed with dementia, how do they find out what they have?
So first, most people don't really receive a dementia diagnosis until they're further into the process. So you can live with dementia for many years before you are actually diagnosed. And there's tests to diagnose. There's also ways to rule it out, but many times it's based on your health indicators and things like that. So if you've, for instance, my mother had vascular dementia, but she had high blood pressure her whole life and she had untreated high blood pressure and heart disease. So therefore, vascular dementia would make sense. So that is the type that she had. So it really is a complex diagnosis, and we have wonderful geriatricians right here in Fort Worth and around the country that can do a wonderful job of diagnosing that. And earlier, better.
And that was
Yeah.
what I was going to ask
Yeah.
you. Earlier, the better,
Earlier, the
right?
better because of interventions and things you can do. A lot of times people don't want to know, they make jokes about it and
Hmm.
they don't want to know if they have dementia. But honestly, if you know, then you can have an intervention and make improvements in your life. So I think that it is best to know. There are medications that can slow the progression as well. So there's many treatments that can be implemented if you get with the right geriatrician or physician that can help you diagnose that and help you improve.
I know the answer to this because I've asked you before, but is there a cure?
There is not a cure, and there's lots of work being done looking for a cure for Alzheimer's type dementia. And I've had people ask me, what will y'all do if there's a cure for Alzheimer's disease? Well, our work will continue because there are lots of different types of dementia. So if we could cure Alzheimer's, that would take care of a lot of the people who need it, but there would still be a lot of dementia-related diseases. Um, I think we will get a cure one day, and I know we're all hopeful for that.
Absolutely. And all of these diseases for sure, but
Yeah.
especially this one. Statistically now, how many families are actually affected by dementia? Do we have a number? I mean,
Well, there's over 7 million people in the United States living with dementia, and almost double that in caregivers. So almost 14 million caregivers. So, and those are unpaid family caregivers that are providing free care at home supporting their loved one in the community. Most people don't live in a place like James L. West, they live at home and their family are supporting them. And so there are a lot of people that are walking that journey, and that's what we're about, supporting those folks.
So, we talk about education, your entire staff that's educating, and tell us who they educate.
Wow. Our education program really was started when we founded James L. West. Like I mentioned earlier, we have always been a clinical site for healthcare providers. So the two local medical schools here in Fort Worth come to James L. West to train their medical residences. The nursing schools, occupational therapy, physical therapy, we have agreements with over 30 academic institutions that bring their students to us to learn about dementia. So that's one group of people that it's very important to us to train. And then the lay caregiver, the person in the community who is supporting a mom or a spouse who just needs to have our education, that they can come to a class, or they can find it online. They can join a support group. They can read our material. I mean, we just want to be there for that person to better understand the journey that they're on, to be able to better communicate with their loved one, to find joy in the process, to not lose hope. A lot of people feel like dementia is a dead end diagnosis, but it's not. There's still lots of quality of life to be lived, and families that enjoy their loved one for many, many years. So we just want to be that hope and that resource for people wherever they're at in the journey.
Wow, amazing. Now, what can you explain what it feels like for a person with dementia walking through this, or is it just so different for everyone?
I think it's probably very different for each person, and I can't put myself in those shoes. I've certainly been around a lot of people who are living that journey, but it's very unique for each person. I think the earlier you receive the diagnosis, probably how you would view it differently. I've seen some amazing people on speaking circuits who have dementia and are talking about it,
Wow.
who are educating others about how they feel. And I would never be able to put myself in their shoes, but it's very fascinating versus someone who really doesn't know they have dementia and have frustrations and struggles, and not really understanding why. So I just can't imagine that it's the same for anyone.
Right. It's not, and we're finding more and more types of dementia. So yeah, gosh.
Yeah, and so many different ways to approach, and of course your family, how your family interacts with you and what they understand is important as well.
We're going to talk about next week with Holly and Jamie from your staff, your educator team. We're going to talk about how the caregivers need help, the family that don't understand, the anger, the guilt, the shame, all of those things, because I'm certain you hear this every day, right?
Oh, sure.
It's
Yeah.
true. It's
Yeah.
true. So, as CEO, the leadership and impact that you make, tell us what leadership looks like in a space like this.
Oh, wow. At James L. West, we're such a specialized organization in what we do. We are so blessed to have experts. And so I feel like I just get to work with that team of experts every day, and make sure we have a healthy culture and that we're a safe place for our employees as well as our families. Always want James L. West to be the most desired place to work, so that we do attract those high quality team members, and we certainly have done well at that. I feel like for me, in the role that I'm in now at James L. West, I do a lot more strategy and planning, and than I do direct care. I'm really not in the direct care role, which in my past I more likely was, right? But I love the board of directors that support our initiatives, that are allowing us to dream about what we'll be in the future. We started with services. We had the day program. We have a great day program I haven't mentioned. And then, of course, our residential care and our rehab program. And then we added home care. So as over the years, they're just allowing us to dream and continue to add services that support those working the journey. Our education program has grown immensely in the last several years. We've gone from just Jamie as the founder of the education program to 3 full-time educators. We have a bilingual educator who we are now reaching out to the Spanish-speaking community, which is so meaningful and certainly a gap that hasn't been touched. And so we're just, as an organization, I get to do a lot of really fun things like that and big dreams and planning for our future. And so currently, we're looking at what's the next decade look like for James O. West.
Right. So the daycare, the adult daycare, tell us about that because, when I heard that term years ago, I just thought, I can't imagine it.
Right.
But it gives so many people life, right?
Oh yes, and we call it the day program.
Good,
So the
right.
senior day program, because it is an engagement center. It's a place for people who are living with dementia to come each day and engage in activities that they enjoy, have wonderful socialization, participate in any activity they would like to participate in. I love the friendships that I see develop over there. And then it also gives the caregiver a break. Some of our caregivers work full time, and so they drop their loved one off every day. Other caregivers just need a break a couple of days a week, and so they drop them off a couple of days a week. It's very flexible. It's just a wonderful engagement center, and we have similar programs that we do at our residential centers, such as music therapy and pet therapy and art therapy and all the fun things that people can do. But we do a lot of gardening, and we have a pretty good guys group that like to do guy things, and so we just have a lot of activities that are really individualized based on what they like to do. So it's a fun place. If you ever have a chance to drop in, it's just a fun, engaging place. So yeah.
Right, right. So you have an in-house, how would I say this? You have 4 floors. I'm going through our notes earlier. 4 floors. Is that it's called an in-house or in?
Yeah, residential care.
There we go.
So on Summit Avenue, we have 4-story building, and we can care for up to 112 people there at any given time. So the folks that either come to live with us full time or they come for rehab is what happens in that building. Our day program's located at a different location, but the residential care is we have a unique philosophy of care, I think is worth mentioning. So in most memory care dementia communities, you'll see large groups of people at every stage of dementia together. And our philosophy of care is we have small houses, so small units of people. So they're in a small setting, very home-like, living room, kitchen. They can participate in meal preparation and delivery, things like that. So it's very homey. But they also are placed on the different houses based on their cognitive level. So we want folks who are at the same cognitive level together because they interact better. It just works better. Their socialization skills are better. Their confidence in communicating and talking to each other and participating in activities is better if they're with others like themselves. So unlike a lot of facilities, we don't put everyone together. So early stage dementias with early stage dementia, mid stage dementias with mid stage dementia. So we have 6 different small houses. So our units might be more common word, but we call it a house.
Right.
And so it is very different, our philosophy of care in placing people with others like themselves. As a person's dementia progresses and they change or have different needs, then they might move to a different house to be with others like themselves.
That's amazing. So, now this may be a silly question, but how do you test to know what cognitive level each of your patients, clients are? Is that something you do in your home?
So our clinical team, which consists of RNs, LVNs, social work, even life enrichment, dietary. That's what our team that really assesses people and their levels of cognition. They can assess their social abilities and where they would best fit.
Right.
Yeah.
That's amazing.
Yeah, we have a great clinical team.
Y'all are busy over there. I know it.
It
I
is a
feel it.
busy place, yes.
I think. Okay, so let's talk about the future because right now we're searching for a cure, many treatments because you see something like every day on treatments. But where do you see the need in the future?
So the population growth is exploding in the older adult population, which means dementia is also growing. But so we do see more and more dementia on the horizon that will need care and services, and it's just a little overwhelming to think about the numbers, honestly, and how many services are going to be needed. But I think really the need is the education piece, to help people understand better about dementia and how they can prevent it, how they can change their lifestyle to live healthier and have a better quality of life in their later years. And so we're on that. I mean, we pride ourselves in teaching about brain health and ways to prevent it. We want people to know that there are things they can do.
So Cheryl, the numbers, is that because people are living longer?
People are living longer for sure, but there's also the living longer with quality to consider. So, and that's oftentimes referred to as a health span. So instead of a lifespan, what's your health span? And so folks living with good quality of life have a great health span. And our goal would be for people to live longer with good health, not
Correct.
necessarily just longer, right? So we want them to live with less chronic diseases, less dementia, and that all is really related to lifestyle, a lot of it.
Absolutely. I mean, it boils down to lifestyle.
Yeah,
Absolutely. And we're going to
yeah,
talk about that next week
yeah.
too. Cheryl, how can the community, how can I help you? How can the community help? I mean, across the world in any centers like this, but how can the community help?
I think knowing more about dementia, not being ignorant about it, really learning about it, knowing that there is still joy, even if you have a dementia diagnosis, knowing that there's a lot of quality of life still left. We focus on what a person's abilities are, not what they've lost. And I think the general public could do well by learning more about that and really being less ageist. We have a lot of that in our society, and a lot of times the jokes, and we all have made the jokes, but I think just being cognizant of the facts rather than the myths. It would be great if we could get more people to understand the facts around dementia.
Because that is amazing. I mean, the facts versus the myths are just absolutely amazing. And knowing your team for however long that I've been associated with you is amazing. Because I still, and educated people do it too. The myths.
Oh, sure.
I mean, it's quite unbelievable. You know, I was telling someone the other day, a physician said to my friend, "There's no hope. There's nothing we can do. We can do nothing with your mother. Just go home and ride it out." Now, this physician that is helping is in his late 70s. And I'm certain, or I'm assuming, when he was in medical school, there wasn't what you guys are doing, educating. I mean, TCU medical school right now. I mean, you're educating physicians of the future, right?
TCU Medical School and UNT Health Science Center,
Yes.
DO School. I mean, both come to James West, but I can tell you that is unique. Most medical schools do not teach gerontology, much less dementia. There's very little aging focus in the curriculum for medical schools, and that's heartbreaking that someone said that, but it's not uncommon. So we really want people to know that there is hope, and there are interventions that you can do and have better quality. And so I guess I wish more than anything that our physicians knew more
Right.
and were able to guide families better to resources like us, because we're only touching a little tiny piece of the world, and there's so many people that need us. It's really heartbreaking to hear that.
Well, I bet, I'm just assuming that there are places all over the United States, for sure, the world, that wants to have a James L. West in their community.
And there are some other great, wonderful places, and I wish we could plop a James L. West down in every community. That would be very exciting. But there are great organizations around the world that are doing education. But I can tell you, Jamie and Holly have mentioned some of the people that get on our education virtual sessions from around the world. Say, I'm here from Australia because they're not talking about that here, or I'm here from, some other European country. So it's interesting that they find us to get educated. But there are lots of places. I don't want to diminish that. Lots and lots of places that are doing great work. It's just not enough.
Not enough.
Yeah.
Absolutely. I have friends that work in hospice, and I have people that work in oncology. On the floor, nurses, and I'm going to ask you the same questions I've asked them before. What keeps you hopeful and in good spirits in a space career that seems heavy to so many people?
Because it's not all heavy. Because we see so many great outcomes and families that are supported at a difficult time of their life, and we know we make a difference every day. I see our hands-on caregivers that love a resident just like their own family member. I don't know how you could want anything better than that. I see our family members that feel supported and heard. So I know, it's life is life. There are tough times in life, and we can be there at a very important time of people's lives and provide that support and care. And so I know we make a difference every day, and that keeps me going.
Absolutely. That is a great way to look at it, because you're so positive and just making a difference at the end of the day.
Yeah.
Absolutely. So if there's one thing that you could get that have the thousands of people listening to this, what would the takeaway be from this show today?
Figure out what you can do to prevent your own dementia. Live a healthier life. Educate yourself. Just do better. Just age well. I've had so many amazing people in my life that I've watched age well, and find yourself someone who's doing it well, and let them mentor you. Just yeah.
Yeah.
Embrace it. It's part of life.
That's beautiful. That is beautiful. How can I help you, and how can this community help you? Because you're a nonprofit, bottom
We
line.
are, yes. Thank you for asking that, Tiffany. We are a not-for-profit, and we do depend on donors to support our mission. And really, our three areas of support that are very important. One is our education program. I mentioned we have 3 full-time educators. We are educating all over the world, and that is a donor-funded program. So we would love to have donations for the support of that. We also provide charitable care for people who can't afford care. So we are able to help people who couldn't otherwise afford either our day program or our residential care. And then we have a veterans program. And so that's another great way to support us. We serve a lot of veterans, and it's not always the government support for the veterans program doesn't always cover our cost. And so we have donors who support that. So those are 3 great ways to support our organization.
That's amazing. So we're going to do that. We're going to definitely put this in the show notes for sure.
Thanks.
But thank you so much for being here.
Sure.
And thank you for the work that you're doing for so many people across the globe, obviously. You and your entire team. I know it takes a team.
Oh, it does.
Takes a village, doesn't it? Great.
Yes.
Well, we're going to put everything in the show notes today, how to find them. And next week, you are going to hear about this education piece with Jamie and Holly from her team. And we just appreciate everything that Cheryl and the entire group over there in Fort Worth, but we can also bring you hope as well. So I say this every single Tuesday, everyone, and I mean it. Keep being fabulous.